Hello and welcome to the Good Ahead podcast, where we host conversations in the areas of mental health, substance use, and intellectual and developmental disabilities. I'm your host, Kevin Wallace with New Vista. In today's episode, I invited Darcy Miller, the Regional Director of Emergency Services at New Vista, to talk about knowing the signs of depression. You'll hear us explore the different complexities of what depression is and what you can do if you're experiencing symptoms. I think these kinds of conversations are so good to be having in order to help break the stigma that comes with dealing with depression, which is also something that we touch on. So we're happy to have you tuning in and hope you enjoy. Well, welcome in to this first conversation that we're having for the Good Ahead podcast. And today we have with us Darcy Miller, the Director of Emergency Services at New Vista. So welcome in, Darcy.
Hi, thank you for having me.
Well, let's get started by just tell us what you do here at New Vista, it being the Director of Emergency Services.
Well, I'm a licensed clinical professional counselor, and I supervise several programs that focus on helping people that are having a behavioral health crisis, whether it's assessment, whether it's our crisis line phone calls, scheduling to get someone in either long-term or quickly, going out into the community and doing an assessment with law enforcement for people that are struggling with suicide, having some type of mental health psychosis, something that would lead to a crisis level situation for behavioral health.
Cool. Well, today we're going to be talking about knowing the signs of depression. Mm-hmm. And so I guess we can't really talk about it without knowing what it is first. So can you shed some light on what depression is, maybe who's susceptible to it, your experience in that area of your expertise. Okay. What is the definition of depression? So
just a general definition of depression is that kind of constant feeling of sadness, right? Feeling lethargic, loss of interest. You don't want to do your normal activities, but it also may look a little bit different. You may feel more irritable, angry, and you just don't want to do the things that you normally do. It may affect your cognitive function, like how you think. You may have a hard time problem solving, thinking clearly, things like that. So it's just that kind of, and it ranges from kind of mild to severe. So mild, maybe you're feeling kind of the blues, just kind of, yuck, right? But you're still able to go to work, or you're still able to do, fixing dinner, things like that. And then you have more severe depression, or somewhere on the continuum, where you just kind of sit, you don't feel like doing anything. You may be able to go to work, but you're not functioning the way you used to, or you start calling in sick. You have a hard time getting out of bed, or you function some, but you come home at the end of the day and you really don't do anything. Like you have a hard time fixing dinner, you don't spend time with your kids or your significant other, things like that. So there's a whole range of what that looks like.
Yeah. So there's varying differences of what depression could be. That's interesting. Like, is it hard for you to maybe know how to diagnose someone with depression? Because someone could be very clearly having depression, right? But maybe someone's showing very little signs of depression. Is it hard to say maybe somebody who's experiencing very little depression to be like, okay, that's still depression, and let's diagnose you with that?
It can be, because we do rely on self-report. So what you bring to the table, right, like what you bring to the session.
So you're relying on the client's word of this is your experience, right, and this is clearly what's going on.
But we do have some really good screeners that have been developed, the PHQ-9, the Beck Depression Inventory, and those are kind of short, simple, to the point. And there have been times where, like, I think it's an adjustment issue, like it's a life experience that they've had. But they come in and maybe things aren't getting better, or it seems to be getting worse. And I'm like, hey, let's kind of figure out what's going on here. Why don't you take this screener? And that can give some really good indicators, because sometimes people don't know what to tell you, or they don't have the words to tell you, right? And if you're feeling sad and it's affecting how you think, it's really hard to put words on that sometimes.
Yeah, definitely. And who is actually susceptible to depression? Is there an age? Is there maybe we talking about gender differences? All that is a whole another conversation maybe. But again, just who can be susceptible to depression?
Well, I think anyone can be susceptible to depression. I heard a psychiatric nurse talk once that with any of the right circumstances, someone can walk in our door because they need treatment for something, depression, anxiety, PTSD, whatever it is. So anyone can be susceptible. There are some things to look out for. Like if you start looking at percentages, the highest percentage age group that are diagnosed with depression are actually 18 to 29 years of age. It's 21%. And again, that ranges from mild to moderate to severe. The ages 45 to 64 is the next group, and that's at 18.4%, but they tend to have more severe depression, which is interesting, if they get diagnosed with major depressive disorder. And then ages 65 and older is also 18.4%. And those are different issues depending on where you are in your stage of life.
Why do you think that is then, that, what was it, 18 to 20?
18 to 29.
29. Why do you think that is the area where the highest percentages for depression?
Well, if you look at the stages, and this is just kind of me looking at it, a lot of these are life changes, right? You have a lot going on between 18 and 29.
Yeah.
Graduating high school, trying
to
figure out...
learning to adult.
Yeah,
right?
Learning to adult, right? And a lot of transition. That's usually when people marry their significant other and get in a more serious relationship. When you look at kind of your mid to late 20s, maybe start having children, and then things seem to settle down in your 30s. And maybe you feel more confident financially, you feel more confident in your relationships, there's less change. But when you look at ages 45 to 64, an empty nest and, potential retirement and financial issues, there could be job loss. It's really scary if you're 45, 50 years old and there's a job loss. How do you get back in, how do you get another job in that workforce? That's a hard age group sometimes. And then with 65 and older, you see a lot of loss of maybe their partner has passed away or their children have moved away, and there's some loneliness that is with there. So there can be a diagnosis, like a medical diagnosis, that can cause some depression, things like that. Yeah.
So how does this even develop in a person? You talked about some factors, but I'm interested to hear what those factors are, most common factors that you see of somebody who has developed depression. What are the things that create that depression in their lives?
Well, the 4 categories that I would look at is, one is genetics. There are people that have a genetic predisposition to depression with your chemistry and your makeup and things like that. There's some research that shows that if you have a parent or a sibling that's been diagnosed with depression, you are 3 times more likely to yourself have depression. So that genetic link is something to look at and to pay attention to, especially if you have another mental health diagnosis like bipolar disorder, schizophrenia, generalized anxiety disorder, things like that. Another category to look at is substance abuse. If you struggle with alcoholism or any type of drug addiction, did it start? It's kind of what came first, the chicken or the egg, right? Yeah. Did you struggle with some type of mental health issue or depression and you're kind of self-medicating with alcohol? Or did your body have a reaction to that drug or alcohol and you become addicted and then things have happened because of that addiction and that disease and choices that you've made in your life that you weren't very happy with, or relationships that have been hurt, and so depression develops from that. So there's a high correlation between those two. Totally. The other is early childhood experiences. Were you raised in a home where there was abuse or domestic violence, with trauma, always experiencing constant criticism? If you look at ACEs, adverse childhood experiences, and the more that you experience the more negative childhood experiences that you have, the more likely you are to have mental health issues as an adult. And then there's also just plain old major life events, breakups, divorces, death, job losses, business failure. Like, we were talking...
Things that you can't really even prepare yourself for, but just
Right.
happen as a result of living life.
Right. Or if you have multiple at one time,
Yeah.
you've had someone that you love pass away, and then you got laid off from your job,
Yeah.
and they both happened
really
at the
builds
same
up.
time.
Yeah.
Yes. So all those things are to pay attention to that can help lead to depression.
Yeah. And are there differences between men and women when it comes to depression?
So women are 2 times as likely to be diagnosed with depression, and I want to clarify, they're more likely to be diagnosed. That there's some debate of whether they really have depression more than men, because depression in men look a little bit different than it does in women. And I don't typically, just because I say men have these type of symptoms doesn't mean that women can't have
Right.
them. But women are more likely to be sad, allow themselves to cry, feel lethargic, things like that. Men are more likely to be irritable and cranky and angry. So they both may have sleep issues. They both may have appetite changes. And the sleeping could be they sleep too much or they don't sleep enough, or they're eating too much or they're not eating enough. They may have cognitive issues where they feel like they can't think clearly or problem solving or whatever. But a woman may be more likely to cry about it, and a man may be more likely to be mad and irritable and get in a fight about it. So that kind of stuff sometimes gets missed in men, because people, when they think of depression, they think of pulling the covers up over your head and not talking to anybody.
Totally. So you can't really necessarily put this in a box of like, if you're a man and you're experiencing this, this, and this, then you have depression. But there are some, like you said, there are some indicators of and differences between men and women. Yeah, that's interesting. And so what can you do if you think you do have depression? How do you seek help for this? And what are the steps that you can take if you're hearing this and you say, okay, well, I've experienced that in my life, maybe a little bit more consistently, and I would like to hear more about steps that you can take to seek treatment.
So if you're looking at kind of mild to moderate depression, and usually those are some of when I talked earlier about functioning depression, right? You're feeling kind of sad, but you're still able to go to work, but you still feel that feelings of hopelessness or some sadness or just unmotivated. You can't think real clearly. If that starts lasting more than 2 weeks, you may want to seek some professional help. You may want to call for a counselor. Sometimes people go to their primary care and talk about medication, but I will tell you, medication and counseling tend to go hand in hand. That is the most effective. There's also some just kind of basic self-care type stuff that you can do if you're not ready to make that jump, and that is look at your eating, look at exercise. Are you isolating yourself? Like, if you are doing that, because that can kind of happen with depression, then maybe it's time to call a friend. And I know it's a little bit more difficult with the pandemic right now, and things are beginning to open up, but talking on the phone, getting on a Zoom or a FaceTime can make the world of difference. If you're in the gaming community, talk to a buddy in the gaming community, things like that. Write a letter. That start reaching out to people. But if it becomes more serious, it always is helpful to look at counseling, look at therapy, call our crisis line, get yourself connected with somebody.
Yeah. You mentioned the pandemic a little bit too. How do you think the pandemic has really affected people, and maybe has there been an increase of depression that you've seen, and even how, like, we can talk about telehealth too, the role that plays in treatment for depression. What are the things that you've seen just hopefully coming out of the end of this pandemic soon? What are the things that you've seen that the pandemic has affected on the people's lives in the realm of depression?
So the interesting thing, and some of this will be anecdotal because the statistics come out about a year or two later, right? But kind of what we're seeing is, in the crisis world of mental health, is that The call volume hasn't changed as much. It's changed a little bit more recently about people reaching out, talking about depression and anxiety and things like that. But those that were struggling with depression, it seemed to make it much worse. So it's called high acuity level. Like they were a little bit sicker. They were a little bit more depressed than they normally would have been, and kind of managing that. And I think there's also been this kind of global, the blues. Like we've all kind of experienced it. Like I've seen it in my own family. I've seen it in my friends. This kind of, when you see someone in person, like there was a time when you saw someone in person, it was almost kind of exciting. Because that was outside of your family. Because you've missed that interaction. We as a people in general are not made to be hermits. That's why there's only a few.
Absolutely.
And some people need more interaction than others, but everybody needs some level of interaction. And so that has been difficult. Isolation can lead to depression. So being more purposeful in that and connecting with that. So I think that has been different, and learning how to do that in a new way with the pandemic. And those who live alone, how do you manage that, right? So being purposeful I've seen people kind of create a small community that they, like you would in your own family. Like, we're going to be careful. We're going to monitor where we go and what we do and reduce the risk, but we're each other's support system and reaching out that way.
Yeah. And thank goodness for technology too, right?
Absolutely.
I mean, you just don't know how vital technology of like FaceTime, Zoom calls, all this stuff, that just how important that has been until you experience something like a pandemic.
Well, and I think so my son got really interested in the history of pandemics, right? He was reading about the last one that started in 1918 and I think kind of finished up around 1921, 22. And they talked a lot about isolation because they didn't have this type of technology, right? They couldn't connect. So they really were kind of with their families by themselves. There was a essay that was done, a woman wrote kind of to her daughter. She had a newborn during this time, and she kind of documented her time and said how it was just you and me, baby girl, for a year. So, she didn't have phones that she could go to and play, and she had to keep her daughter safe. She had this new infant, and she wanted to make sure that she survived and thrived. And now her daughter has these letters, or this diary of sorts, this journal of sorts that documents her mother's time during this.
Yeah, that's crazy.
So, but that's a coping skill, right?
Yeah.
So we don't have Zoom, but we sure can write things down. And she was forward thinking, like, I want to remember this time. I want her to know of this time.
This break in the conversation is a reminder that the Good Ahead podcast is brought to you by New Vista. Now, New Vista is a community mental health center caring for our central Kentucky communities in the areas of mental health, substance use, and intellectual and developmental disabilities. If you want to know more about New Vista services, call our 24-hour helpline at 1-800-928-8000 or visit our website at www.newvista.org. Let's get back to the conversation with Darcy Miller. Okay, with your experience in telehealth, let's talk about that a little bit.
Sure.
What has that been like? Have people been really receptive? Was there kind of a trial period of, I don't know about this? What's your experience been like?
So it was mixed. Yeah. There was definitely people that were like, yes, this makes my life so much easier. There were people who were like, no, I want to see you in person. This is really difficult. And in the beginning, it's like, well, I'll just wait a few months when you go back in person.
Yeah.
That didn't happen.
Right.
We're still, our governor and just kind of CDC guidelines are, if you can do it telehealth, we want you to continue to do it until things have eased up a little bit. So it got more normal, and I think it has actually been really, really helpful. And we had the wonderful opportunity where they eased up the restrictions that if someone didn't have a screen, a laptop, a cell phone, a tablet, whatever, to Zoom in on, you could also talk to people on the telephone and be able to get reimbursed for that, which has not historically, we have not been able to do. So we've been really limited.
Wow.
But being, something is better than nothing. So talking to people, getting people through that. So having that combination has really made a difference. And a lot of the research shows that I think people think it's a lower standard of care. Mm-hmm. The research shows that that's not true.
Yeah.
That the standard of care at the end of the day, people are usually, even though you may want to be face-to-face, you're still getting good care via telehealth. You're still getting the things that you need. So that has been really interesting, and the transition that has happened, and the flexibility. I think going forward, we will probably definitely have a hybrid model, because for some people that works really, really well.
Yeah.
It opens up the floodgates of people who work, and maybe they need to go on their lunch break, or maybe their lunch break is at 10 a.m., but they can't travel to the office and then travel back to work.
Yeah, I would say probably travel time is one of the biggest factors of people either canceling or, being skeptical about doing something like, or seeking help, is because it takes time to get to an appointment and come back, and you got to block an extra amount of time out of your schedule to do something like that.
And how do you ask for that from your employer? Or
right,
how do you work around, like with your kids and things like that? Well, telehealth makes that a little bit easier.
Yeah.
So if you have that as an option, that's really wonderful.
Yeah.
So I think people thought it was going to be a lower standard, but it has just not been. And I think it's actually really broadened how we provide services, which is just helpful to everybody.
Yeah. So post-pandemic, you think this is something that's going to be here to stay?
Yes,
because you mentioned hybrid. Like I can see how that would be such an asset moving forward in the area of mental health, of just you're getting to have more options to treat people, and more options is always great, because then that broadens the horizon of people that are able to come and seek treatment.
Well, even as simple as you're stuck in a traffic jam, and there's a car accident, and you didn't expect that, and you call your therapist and say, hey, I can pull over. I was coming to you anyway. Can I pull over, and can we telehealth in instead? Yeah. I've got my phone. Clock it on your on your car dash, and telehealth in. Yeah. So who knows?
Wow. Well, that's great. One of the last questions I have about this, at least in my upbringing, or not upbringing, but growing up, it seems like there's been a stigma for reaching out and getting help, and something that is kind of hard to admit about. So, like, it's not an easy thing to come forward and say, hey, I'm depressed.
Right.
Or I might be depressed, or I'm feeling this way. So why is there a stigma around this? And, how can you break through the stigma of seeking help, and like, why is it so important to do that?
Well, first of all, I think it's been viewed as a character flaw instead of a disease or an illness.
Yeah, like this is something that is fundamentally wrong with you.
Right. There's something morally wrong with you, and we are in Kentucky, so maybe you haven't prayed enough, or you've done something wrong in your life, or you haven't done the things that you need to do. There can be cultural issues but it still all surrounds that kind of character. It's a character flaw. It's a moral failing, rather than it's chemicals in your brain that are not working. That it's a traumatic life event that most people, if you were to hear that, you'd be like, well, dadgummit, I'd be depressed too. So getting away from it being a character flaw and looking at it as this really is even if it's a life event, it still changes the chemistry in your brain that triggers that depression, that lack of serotonin, or whatever happens. So looking at it as this is a mental health issue that is very common, that a lot of people experience, and viewing it like how we view medical treatment, right? Like, is it a character issue if you break your leg? No, you just broke your leg. Even if you were doing something silly, right? Or even if you broke your leg, or like how many people broken their leg because they tripped over something in their house, right? Not because they were skydiving.
Just because I'm clumsy.
Right, just because you're clumsy. Well, that's not a character or a moral failing. That just happens sometimes, and you go to the doctor and you get it treated. And depression is the same way. Things happen. Life happens. There are chemical imbalances in our brain. We don't think it's a character failing if someone has diabetes,
Yeah.
right, or epilepsy. And those are kind of long-term illnesses that people get treatment for. And especially if you look at diabetes, not only do you usually do behavioral change, but you get medication too,
Yeah.
right?
Yeah.
Insulin, what have you. I think the same thing can happen with depression depending on how severe it is. So viewing that a little bit differently. I think you asked a second part of the question. I don't remember what it was.
Well, what would you tell somebody if there's that stigma there?
That it's not a moral failing,
Yeah.
and many people experience this. And just because they don't tell you that they're not experiencing it doesn't
Yeah.
mean that it doesn't happen,
Right,
right? It's very common. Most people have some feelings of, even if it's not major depression, right, but some level of depression at some point in their life, whether it's after, that you've heard of postpartum depression, right, after childbirth and things like that, or divorce or any kind of life changes. So it's just trying to figure out, has it interfered with your everyday life? Is it keeping you from doing the things that you would normally do on a long term? Like, not just, yes, I've had a hard time, but I'm still functioning, I'm still laughing, I'm still having that support system, or is all that gone? And if all that is beginning to go, that's when it's like, all right, just like, if you twisted your ankle and you're still having a hard time walking on it, now it's time to go to the doctor. Now it's time to maybe go see a counselor and figure out what's going on. And it doesn't necessarily mean that this is the label for the rest of your life. This is just what's going on right now.
Yeah, this isn't who you are.
Right.
It's just maybe something that you're experiencing, and you can learn how to have this in your life and still move past it, learn to deal with it, and let this not be a part of not who you are.
It doesn't define you.
Yeah, it doesn't define you.
Just like having diabetes shouldn't define you as,
At the core of who you are, that is not, you're not depressed. You're not a depressed person.
Right.
Yeah.
It's just something that you have that you need to treat.
Yeah. Well, okay, so now going, I guess, back to New Vista, what are some ways that New Vista, like your role, the organization as a whole, how have you seen New Vista, help people with depression and journey through that with them?
So, one, you can always schedule an appointment through our 1-800 number, through our 1-800 line, our customer service line, 1-800-928-8000.
Right.
So you can always schedule an appointment. It also operates as a crisis line. We are Lifeline certified, the National Suicide Prevention Lifeline. So say your depression gets more severe. You're having suicidal thoughts, it's moving you into some type of crisis, or you're struggling with substance use, and maybe you've been clean for a long time, but you're risking falling off the wagon, or you're like, I'm having problems with addiction, or we're talking about depression here, but it could be anything. It could be anxiety, it could be relationship issues, it could be job loss, it could be any type of, you're concerned that you have bipolar disorder or anything. You're worried your child has ADHD or anxiety or what have you. You can call for an appointment. And if it moves to the next level where you feel like, hey, I'm really worried that I'm at risk. Like, I'm having those suicidal thoughts. I can't see my future. I'm feeling kind of hopeless, or I'm feeling stuck, or I've heard people talk about feeling like there's darkness surrounding them, or feeling like there's a weight on their shoulders just pushing them down. I had one young woman, I was a teenager actually, we talked about, she felt like she was walking on the bottom of the ocean. And she could see the light at the top, but it's like she couldn't get there, right? So it's 24/7. We have a crisis line 24/7 that you can talk to someone, that you can schedule an appointment. We do emergency appointments if needed. So I think the first step is to reach out. And then once you reach out to us, we'll kind of figure out what you need and how quickly you need it.
I think one of the main questions, too, that people might have, or maybe even hesitations, is how do you financially pay for something like this? Does health insurance cover it? What if you don't have health insurance? All these things that could play into this.
Health insurance definitely covers it. And whether it's like a private health insurance through your employer, or with the exchanges, or if you have an MCO Medicaid program, we cover all of that. But we also have a sliding scale fee. That's the nice thing about being a community mental health center, is that we are kind of the safety net for people who don't have insurance, or their insurance has lapsed, or especially during this time, so many people have lost their jobs, or kind of that gig economy where they put some things together and they were able to pay for their own insurance, but they don't have that money coming in. So we do have a sliding scale fee, and that is already set up. And we also have referred people to, especially if you've lost your job or you're unemployed for some reason and you call in and you don't have insurance, we recommend and we try to connect them with like a Medicaid navigator to see if they qualify. And if they don't, it doesn't matter. We'll still use the sliding scale fee. But if you're struggling financially, that may be a good connection. And you may not think that you qualify, but you might. You never know. But maybe people are afraid to reach out, or they're used to not qualifying in the past, but they do now because of life circumstances. And just kind of, it helps get you through. It helps with the finances. But don't be afraid to call because of payer. We'll help you figure it out.
Yeah, that's great. Well, as a final note, I think it'd be fitting to end on just a word of encouragement for somebody who may be listening and experiencing depression. Maybe they've already sought help and treatment, or maybe they're on the fence about it. What are some things that you'd say to encourage that person in that state?
So my motto in emergency services is kind of using that crisis or the worst day of your life as an opportunity, and it not just being the worst day of your life, but an opportunity for change, to going to the next step and getting the help and really starting a journey for something positive and wonderful. So not staying in, for lack of a better term, like not staying in the darkness, right? In the isolation and the loneliness, but taking that step and being, it's so hard sometimes to be brave because, again, we look at it as a character flaw, but it's not a character flaw. It's not a moral failing. It's taking that next step and saying, hey, this is what I need to do for myself, not only to help myself, but my family and my loved ones, and get me where I need to be on the path of healthiness.
Yeah. Wow, that's so good. And New Vista, we're here to help.
We're here to help. We see the good ahead.
We do. We see the good ahead. Well, Darcy, thank you so much for coming in and talking with us about depression and everything that might come with that. I know I learned a lot about it, and hope this was helpful and insightful to our viewers, our listeners.
I hope so too.
Yeah. All right. Well, thank you very much.
Thank you.
Well, thank you for joining us in today's episode. Just a reminder that this podcast is brought to you by New Vista. We assist individuals, children, and families in the enhancement of their well-being through mental health, substance use, and intellectual and developmental disability services. We see the good ahead for all individuals in our communities. Again, if you need help, call our 24-hour helpline at 1-800-928-8000 or visit our website at www.newvista.org. We hope you enjoyed today's episode, and we'll see you next time.